Welcome to This Explainer. Today, we are going to completely reframe how you think about sleep. For decades, we've basically treated sleep as this passive state of rest, right? Like a biological off switch you just flip when you're exhausted or brain fogged. But the reality is actually far more fascinating. Sleep is a highly active, biologically dynamic state that literally dictates your cardiovascular longevity.
In fact, the American Heart Association recently updated their core health guidelines to what they're now calling Life's Essential 8. And by adding sleep to this list, they officially recognized poor sleep not just as some secondary lifestyle factor, but as a primary causal driver of cardiovascular mortality.
Okay, let's dive right into this. Here is our intellectual roadmap for today. Number 1, the new biology of sleep. 2, the autonomic balancing act. 3, the sleep duration paradox. 4, the hidden cost of irregularity. 5, pathologies of the night. And 6, phenotypes and targeted therapies.
Section 1. The new biology of sleep, beyond passive rest.
First things first, we absolutely need to shatter this illusion that sleep is just downtime. Missing sleep doesn't just make you tired or give you a bit of brain fog. It actually triggers a massive biological cascade. We're talking about systemic inflammation, a hyperactive stress response in your HPA axis, and severe endothelial dysfunction. So, on a microscopic level, chronic sleep deprivation is mechanically remodeling your arteries.
Moving right along to Section 2, the autonomic balancing act, sympathetic versus parasympathetic.
Let's look at the actual molecular mechanisms here. I want you to picture a continuous tug of war regulating your cardiovascular system every single second of the day. On one side, we have the sympathetic nervous system. That's your fight or flight mode. It uses catecholamines to drive up your heart rate and constrict your blood vessels. On the other side, we have the parasympathetic rest and digest system. Driven by acetylcholine, this system hits specific receptors in your heart to physically lower your pulse and promote this restorative vasodilation.
And that brings us to a really crucial adaptive physiologic process called nocturnal dipping. During deep, non-REM sleep, your heart rate, cardiac output, and systemic blood pressure all drop, which gives your cardiovascular system a much-needed rest. Melatonin is basically the master conductor here. Peaking between 2 and 4 a.m., melatonin actively suppresses that sympathetic tone and enhances parasympathetic rest. Without this nocturnal dip, your vascular system just remains under constant, damaging stress, which accelerates the aging of your heart.
All right, Section 3, the sleep duration paradox, the Goldilocks principle.
Now, what's really interesting here is that the data reveals a striking, highly counterintuitive U-shaped curve. Based on a massive meta-analysis of over 816,000 individuals, we now know that short sleep, meaning less than 7 hours, increases cardiovascular disease mortality with a risk ratio of 1.19. But get this, sleeping more than 9 hours carries an even higher risk ratio of 1.37. So the true biological sweet spot is strictly between 7 and 8 hours. This forces us to completely rewrite the narrative. Sleeping over 8 hours on a regular basis is actually not a benign behavior. It's not catching up or just getting extra rest. In adults, excessive sleep duration is a clinical marker of elevated cardiometabolic risk. It completely shatters the myth that more sleep is always better.
Let's see how this builds in Section 4, the hidden cost of irregularity beyond total hours.
Because it turns out, exactly when you sleep is just as critical as how much you sleep. Enter the concept of social jet lag. This is the chronic misalignment that happens when your weekend sleep schedule drastically differs from your workday schedule, and biology heavily penalizes this. For every single 1-hour deviation between your work schedule and your natural rhythm, your odds of being classified with high cardiovascular risk jump by a staggering 31%.
And the statistics get even heavier. In a massive prospective study from the UK Biobank involving over 86,000 individuals, researchers looked closely at day-to-day sleep irregularity. A mere 1-hour standard deviation in your day-to-day sleep duration yields a 1.19 hazard ratio for incident major cardiovascular events.
Breaking that down, day-to-day irregularity is a really potent, independent predictor of catastrophic events. We're looking at a 1.23 hazard ratio for heart attacks and a 1.17 hazard ratio for stroke. And paradoxically, this association is actually stronger among individuals who average over 8 hours of sleep. You literally cannot just sleep long hours to compensate for a highly irregular schedule. The inconsistency itself is accelerating vascular aging.
Which leads us to Section 5, pathologies of the night,
when rest becomes damage.
Let's look at what happens when our biology gets hijacked. Take obstructive sleep apnea, for example. This isn't just loud snoring, it is a violent physiological event. Airway collapse leads to intermittent hypoxia, which is basically oxygen starvation, which then triggers a massive sympathetic fight-or-flight surge. This repetitive choking blunts your blood pressure dip and literally bathes your vascular system in oxidative stress all night long.
And the clinical consequences of this are severe. Untreated obstructive sleep apnea is an independent driver of atrial fibrillation. For patients undergoing catheter ablation to treat their AFib, leaving their sleep apnea untreated increases their risk of recurrence by up to fourfold.
But it's not just respiratory issues either. Consider restless leg syndrome. Driven by underlying brain iron deficiency and dopamine dysregulation, it causes these periodic leg movements during sleep. And these aren't just annoying twitches, right? They trigger nocturnal blood pressure surges and increased sympathetic tone, physically disrupting your physiological blood pressure dip.
Finally, we reach Section 6, Phenotypes and Targeted Therapies, the illusion of recovery.
As we enter our final act, we really have to confront the difference between feeling rested and actually being biologically recovered, which sets up this provocative scientific mystery. Does fixing insomnia actually fix the heart?
Well, the answer is deeply counterintuitive. Cognitive behavioral therapy for insomnia, or CBDI, is the absolute gold standard for treating the subjective experience of insomnia. Patients feel better and they say they sleep better. However, randomized trials show it completely fails to lower objective cardiovascular biomarkers. It doesn't move the needle on blood pressure, resting heart rates, or inflammatory cytokines like IL-6 and TNF-alpha. You might feel cured, but your vascular system could still be under attack.
So the crucial point is that modern medicine must target specific biological phenotypes. We can't just treat poor sleep as a broad category. We need to identify specific profiles, like the hyper-aroused short sleeper. In sleep apnea, we must assess the true hypoxic burden, the actual oxygen depth, rather than just counting breathing pauses. We have to use therapies like CPAP to lower sympathetic tone, and conversely, strictly avoid certain advanced ventilators in specific heart failure patients because it can actually increase mortality.
And all of this brilliantly illustrates our core thesis today. The cardiovascular system operates under strict circadian regulation. Decoupling these systems results in accelerated vascular aging. Optimizing your sleep isn't about chasing a feeling, it is fundamentally about protecting the delicate balance of autonomic neurotransmission.
Which leaves us with one final, vital question to ponder. Are you prioritizing the feeling of rest or the physiological reality of your cardiovascular recovery? I highly encourage you to audit your own circadian alignment. Pay close attention to your sleep regularity because, as we've seen, your heart is keeping score every single night. Thanks so much for joining me for this explainer, and I will see you next time.